Hi everyone, this is a video about large intestine bacterial overgrowth, also known as LIBO. So there's a question that was posted on one of my other videos, and it says, what do we need to look at in fecal culture to understand that we have LIBO? Do we need to look at overgrowth of a particular bacterium? Thank you. So, thank you for the question. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your personal healthcare provider to get that advice. So, to my understanding, there's not really a consensus on exactly what constitutes a positive LIBO test. There's relative consensus, fairly strong consensus on what constitutes a positive SIBO test and what constitutes a positive H. pylori test and what constitutes positive parasite tests and whatnot. With LIBO, this large intestine bacterial overgrowth, I don't believe that I haven't seen anyways or heard at conferences or in any materials that I've, educational materials that I've seen about LIBO that there's any particular consensus. There's different tests out there that are available that assess large intestine bacteria. And so I have kind of the criteria that I use in my practice and what I see play out as being logical, and I have colleagues who use the same methodology, and I'm sure other people have different opinions on it. So not a very straightforward answer, but an honest answer at least, that I don't believe that there's a consensus about this. So I can tell you what I do in my practice, and then if folks have heard other things from their clinicians, or if there's any clinicians listening and you do something totally different or somewhat different, I'd love to hear about it. So please post in the comment section and let me know. So the way that I assess whether or not someone has large intestinal bacterial overgrowth is I use a stool culture test to do that. I mean, I don't personally do it. The lab thankfully does that. And I look at the overall quantification of the bacteria that come up. So the lab that we use is called Doctor's Data. They're based out of Illinois. There's other labs out there that do culture testing as well. I'm not saying Doctor's Data is the best or certainly the only option. I like them because they just have really good price point, and I think they have really great tests. So it's nice when it's a great test and it's a good price point. So it's a nice win-win. So the stool culture essentially will tell us for each bacteria that comes up on the culture, it's rated on a scale from 0 to 4. So if it's a 0, it just doesn't come up on the report at all. It's kind of at a low enough level where it's not detectable. Bearing in mind that it's large intestine bacterial overgrowth. So it's an overgrowth of bacteria that are supposed to be there in the intestine, in the large intestine. It's not some foreign invader that's, come in that, you ate a bad pineapple or something and got infected with this bacteria. It's a overgrowth of bacteria that are there. So there's just too many of what's supposed to be there. So for each of these bacterial species that they culture for, so it either comes up as a 0, meaning it just doesn't come up on the report, or it's a +1, +2, +3, or +4. So +1 would mean there's just a little bit coming up on the culture dish, +4 would mean there's a lot. And so what I personally do is I tally the number of all the bacteria that come up. So if there's, say, 2 species that are at a 2 out of 4 level and say 2 species that are at a 3 out of 4 level, then tallying those up, 2 + 2 + 3 + 3 is 10 if memory serves, and that would be sort of the grand total number of bacteria that came up on that particular test. And so what I found is there are certain kind of benchmark criteria to say, does it seem like that is a 10 actually a problematic number? And so without kind of getting into the weeds of it, if I saw a 10 in total for one of my patients, I'd say, well, that's probably somewhere like, that's in more of like a moderate LIBO kind of territory. Whereas if the patient only had like a 2, I find that even folks who are perfectly healthy, asymptomatic, oftentimes, a 2 might just be totally normal for some people. So it's just really based on my clinical experience, what I've seen. I kind of have certain ranges that seem to be that seem to work. And again, having compared notes with other colleagues, then that seems to be in line with what some of my colleagues use as well. So it's really just this quantification of the overall amount of bacteria that are growing, and it's not a specific bacterium that's coming up. So thank you for the question. I hope that this answered your question. If it didn't, please post in the comment section below, and I will try to answer it in a more fulsome or a different way. If anybody else has any questions about this topic or anything else, just post in the comment section below, and I'll answer as soon as I can.